I'm going to keep you updated about a headline story from or regarding Honduras from Reuters, where they have here Honduras mandates face masks again as respiratory illnesses spike. You can see this was from July 25th, 2025, and you see a line of people outside of a clinic. And in effect, here, they have been required to wear surgical masks again when coming into hospital because of a surge in illnesses. Now, for those who have been following Gert van den Bosch, he has always predicted that there is going to be a variant that causes significant problems globally. And largely, he has stated that this is related to the fact that viral variants are being driven because of the mass vaccination campaign and the fact that the immune system is not adequately primed and therefore causes further variants to occur. Important to note that even though he has said this and it has played out in real time, it's not necessarily accepted by the scientific community. But the case of Honduras stands out to me, and it's because I've been following this since early or late 2021 because of some incredible work by a doctor there, Dr. Fernando Valiero, and what they did to save lives in Honduras. I'll come to that in just a moment, but just to remind you, coming up in a few days' time is our conference, NeuroCovid, the neurological aftermath of COVID 19. For those who don't understand that the virus is still continuing to circulate and doing significant damage, this is for you. But it leads us back now to the fact that the reality is there is likely to be another variant with a surge across the world. What will happen is that masking, as I said, is going to return. This is the reality. And many people are going to resist it because, as far as they're concerned, it doesn't work. And this is specifically important in terms of the viewpoints of the unvaccinated cohort. My only advice is this: at this point, I think, I'll say it, but I don't think anybody will ever do it. I suspect that we need to mask the vaccinated. And the reason I say that is because of the association of COVID with IgG4 from the boosters, increased infection, poorer or weaker immunity to COVID. And once you have COVID, it weakens your immunity to other viruses because it blunts the interferon response. They are more likely, therefore, to get interferon related infections, influenza, viral infections, mycoplasma, streptococcus. And so, therefore, they then become a source of infection, not just for COVID. That's where the advice I would give to the unvaccinated. When you think about masking, think about protecting your immune system from the huge variety of infections that are now likely, possibly being carried by people who have weaker immunity to COVID because of blunted interferon response. I'm trying to say this as gently as I can. And that's therefore my advice. Don't necessarily close your mind to the fact that this may be there for your own protection rather than anything else. But let's get back to what's happening in Honduras. What they found is that over 5 years after the outbreak, Honduras has reinstated mandatory mask wearing in public spaces amid a spike in respiratory illnesses as a variant of the virus spreads through the Central American country. And this week, they had 2 deaths from the virus among patients with underlying health conditions. And this is the reality, is that COVID is a comorbid disease. It primarily affects those people with comorbidities in terms of severe disease. However, what we're seeing now is that the presentation of infection has changed. And that's where it's being underestimated. So, Honduras stands out as a very interesting case because in December of 2021, I interviewed Dr. Fernando Valiero. And this doctor did something very, very interesting. He was part of a very important piece of research or work. They did early multi-drug treatment for SARS-CoV-2 and decreased case fatality rates in Honduras. Now, this is still a preprint. It was put out there in August of 2021. It's now published in the Epidemiology Journal, International Journal. And essentially, what they did is that they did a multi-drug therapeutic strategy. And looking at what happened in Honduras, this was associated with a case fatality rate decrease from 9.33% to 2.97%. The reason this country had stood out was because their infrastructure was so weak in terms of ICU beds. And this doctor, Dr. Valiera, is an ICU doctor. And he was highlighting they just didn't have the resources to handle lots of severe COVID-19. And so they got very, very creative. And you can imagine their multi-drug strategy covered a number of therapies that are not necessarily considered to be things that work. Whichever way you take it, their outcomes turned out to be one of the best in Central America. And as I said, I believe in outcome-based medicine rather than credential-based medicine that doesn't necessarily have the outcomes. And so I think that it's important to see what they did because they used some specific drugs that one of them rhymes with pectin. And this was part of the difficulty as to why it probably has not been used elsewhere. And they combined it here, and so you can see it in the paper here. This is from the paper. It's what they called a maize protocol, Spanish for corn, Honduras' staple food. They used a mouthwash of hypochlorite and hydrogen peroxide. They then use azithromycin, ivermectin, and zinc. And if patients had continued to have symptoms after 7 days, they were prescribed enhanced outpatient therapy, which included an anti-inflammatory, colchicine, and prednisone, and rivaroxaban. And this multi-drug therapy dropped their outcomes significantly. They were having, at the time, one of the worst outcomes. And you can see from the chart here, this was what was happening. They had to do something. They put in place this, and it just absolutely crashed mortality. So this stood out to me as being very significant because what happened to that protocol? As you can imagine, it disappeared. And so I went looking and found the tag recommendations for COVID. And this is based around the Pan American Health Organization, PAHO, in 2024. They are part of the WHO. And essentially, their recommendations now are focused on trying to get as many people vaccinated, prioritize vaccination as an essential health service, and implement immunization strategies to reach all target populations, especially the underserved and vulnerable population groups. When you go through this, there is no mention of the fact that Honduras crashed its mortality by using a combination protocol. There's no interest in it. Doesn't matter that it worked. It's just discounted because it doesn't fit the narrative. One thing is for certain is that I think that that kind of science and medicine is done. We want science and medicine that's based around outcomes. And when I look back to what they did in 2021 and how incredibly successful it was, and the fact that in effect this has now been discarded to take on board strategies that are not even working in the first world countries. I mean, the circulation of virus in highly vaccinated regions should be a red flag to make people think we've got a problem. I mean, how long does it take people to observe the obvious? If this was going to be the critical strategy, it would have worked already. That's the reality. What people forget is the science tells us that vaccination is way focused on producing and reducing the risk of severe COVID 19 in the vulnerable high risk cohort. In terms of transmission, even though there have been studies talking about it, it doesn't fit the real world evidence. And so, what we have is a situation here where countries that were successful with a strategy have discarded it because they are following the crowd. Instead of Honduras becoming the example for the rest of the world for what they did and the outcomes that they have proven, they have not trusted their outcomes. They have stepped away from it. And guess what? When you do that, you then start to see unusual patterns occurring. What are they going to do now? If they continue to see this surge of illness, will they then go back to basic principles of what had worked before, or will they continue to follow the crowd? This is a difficult time for science, and it's a difficult time for those who actually have seen the outcomes and trust the outcomes. Sadly, now it's still a huge battle because, as we can see here, Honduras, although successful in the past, may have discarded their success, and it's what I call grabbing defeat from the jaws of victory. Join us as we are going to do our next conference about NeuroCovid. Will become even more important as this is probably a precursor of what is likely to be occurring across the world. We're going to see a new variant surging. I don't know if it will be the Hivicron that Gert has predicted, but whichever way we take it, this is likely to still make a lot of people sick. Let's be prepared. And as I warn you, if masks come up and you're unvaccinated, believe me, you may be doing it for yourself, not necessarily for those around you. Have a good evening.